Good morning, everyone. How are you? I just wanted to thank the SAGES Committee for giving me this opportunity to present, and also for the moderators for being here for this presentation. Let's see. Whoa.
Just the green button.
Oh, this one.
The big green? No, the big one.
Oh, of course. We have no disclosures. So I'll be presenting the long-term outcomes following endoscopic stenting in the management of leaks after bariatric surgery. So leaks are a feared complication after bariatric surgery, and traditionally these acute leaks were treated with surgical intervention, with non-surgical management being reserved for hemodynamically stable patients with chronic leaks. The use of endoscopic stenting for the treatments of leaks after bariatric surgery was first reported by Dr. Teixeira and his group back in 2006. And since then, stenting has been shown to be effective. However, questions regarding its safety and efficacy have been raised, and alternative endoscopic approaches such as endoscopic vacuum therapy and internal drainage have been proposed. It's important to note that stenting technology has improved over time, and although many centers have studied the efficacy of stents, no one has actually looked at the long-term effects of the endoscopic stents on the patient. And so the purpose of this presentation, of this study, was to evaluate the evolution of stenting in order to determine its efficacy over time, as well as the impact of stent fixation on outcomes. So this is a retrospective review of patients who underwent endoscopic stenting after various procedures from 2005 to 2017. Now, prior to 2012, these stents were placed, but they weren't secured. However, after 2012 and the development of the endoscopic suturing techniques, stents were secured via figure-of-8 overstitch. In this study, we had 37 patients. 17 patients were before 2012, and 20 patients were after 2012. And then demographics, type of stent, stent migration, complications, revision surgery, weight loss data, and the incidence of reflux and chronic PPI use were collected and analyzed. So these are just the demographics of the two groups, the group before 2012 and the group after 2012. And there were no real significant differences between the two groups in terms of demographics, age, or gender. In terms of the type of operation, these patients had about 43.24% of patients had a sleeve gastrectomy, 40.54% patients had a Roux-en-Y gastric bypass, 5.41% of patients had a duodenal switch, and 10.81% of patients, or 4 of them, had miscellaneous foregut procedures, including 2 gastrectomies, an esophagectomy, and a paraesophageal hernia repair. Now looking at the two groups here, before 2012 and after 2012, the migration rate after 2012 is much lower. It's a 15% migration rate versus a 41.18% migration rate before 2012. This was not a statistically significant value, however, there's a decreasing trend. With respect to the success rate, both treatment failures in our study occurred in the group after 2012. There were 2 of them. And with respect to revision surgery, or the incidence of revision surgery, it was about the same for both groups. Now looking at sleeves versus gastric bypasses, it's interesting to note that both of our failures, our treatment failures, were in the sleeve gastrectomy group, whereas they were none in the gastric bypass group. And again, with respect to migration rates and the incidence of revision surgery, it was about the same for when looking at both of them. So overall, we had a 94.59% success rate. That's 35 out of 37 patients. With respect to revision surgery, the indications for a sleeve revision were 1 patient who had chronic reflux and was converted to a bypass, and 1 of our treatment failures who had a persistent leak and got converted from a bypass, from a sleeve to a bypass, excuse me. With respect to bypass revisions, the indications included a stricture, an intussusception, and 1 patient who had failure to thrive and ended up having a reversal of his Roux-en-Y gastric bypass. With respect to PO intolerance, 5 out of the 20 patients for which this data were available were readmitted for PO intolerance, and in 3 of these cases, stent removal happened. It's important to note that no patients in our study group required TPN. All of our patients were on oral feeds. And there was 1 death in our study group. This patient had fungal sepsis 1 year after removal of her stent, and it's important to know that at the time of the removal of her stent, she didn't have any persistent or leak or anything like that, and that's on upper endoscopy as well as an upper GI study. So looking at the excess body weight loss in the months of follow-up, we had, for the 21 patients for which this data was available, we had an average of 57.21% excess body weight loss over an average of 21 months follow-up with 1 of our patients, going up to 70 months of follow-up for 1 of our patients. Looking at patients who reported symptoms of reflux and chronic PPI use. Of the 17 patients for which this data was available, 7 patients, or 41.17%, reported symptoms of reflux. However, 10 patients, or 58.82%, of patients reported chronic PPI use, and this can sort of be explained by the fact that many patients were continuing to take PPIs in the absence of symptoms because they said that they were never told to stop taking them. So in conclusion, endoscopic stents are effective and durable in treating leaks after bariatric surgery. While they can be complicated by stent migration and PO intolerance, newer stent technologies and methods of endoscopic suturing have decreased the incidence of stent migration. It's also important to note that one of the limitations is the actual stent design itself, which are not specifically designed for the post-bariatric anatomy, and it's possible that in the future with newer designs and newer materials that this incidence of stent migration will actually continue to decrease. It's also important to note that stent migration did not adversely impact failure rates in our patient group, nor was the migration associated with the incidence of revision surgery. Finally, stenting did not adversely impact weight loss, and patients post-stenting had relatively low rates of chronic reflux symptoms. So really, in our conclusion, our experience with stenting was very positive, and it's a very good alternative in treating leaks after bariatric surgery. Thank you.